Hi everyone, my name is Mohammad Ibrahim Kazi. I and my team are here to present our project on mortality risk analysis using Tableau. Before I proceed further, I would like to extend our thanks to InnoAnalytics Director Sharat Manikonda, and also I would like to thank the mentor of our project, SP Pavni and Raju. Now I would like to introduce my team members, myself Mohammad Ibrahim, Chaitanya, Manuja, Ramya, Chandra, Anusha, Arjun, Ayush, Divya, Sumedh, Akhila, Ansh, Raja, Karthik, Mohan Raj, Karthik, Raju, Karthik, Mamta, Mona, Nayan, Sandeep, Oman, and Shaina. These are the team members who have put the ample of effort these days to get a successful outcome of the project. Coming now, I would like to take you through the basic introduction of the project, like what is the purpose and the benefits of doing this project and what we are trying to achieve by this. Coming to the objective of the project is to identify what are the various diseases that have an impact on a patient's mortality risk. Based on the age factor, how we can minimize the mortality risk. So for it, we had to do various visualizations and we have to understand what are the various diseases that have the highest impact on the patient based on the particular age group, and identify which age group is getting impacted the most by certain diseases. And the constraints are to minimize the consumption of alcohol smoking by the younger age group, maximizing the immunity of the patients by using proper medication, by providing vaccinations, and some physical activities as well. And the last constraint was to minimize the cause of death among the different age group. Here I would like to conclude from my end, and my team members will be taking you through the further details of the project.
Thank you, Ibrahim. Myself, my name is Ramya. Let's discuss about our project outline. First of all, we have business understanding, data understanding, technical stacks, project architecture, data preparation and description, data visualizations and their summaries, storyboards, and report. Uh, Business understanding. Mortality may be reported for people who have certain diseases in any particular area or a country or etc. We have a data with patients with different diseases, medications, background history, like medical background history, IP hist, etc. Using the history of patients, here we are analyzing the medical consequences with respect to the mortality risk. Thank you. And Anu will continue the screen.
Thank you, Ramya. My name is Anushya. Let's try to understand the data first. Here we are using mortality extract PSC2 UK healthcare dataset. It is in .csv format. Here we are having 83 columns and then 10,000 records. These 10,000 records describes about the patients and their different diseases they are getting affected, and then their mortality risk. SK patient ID, gender, GP practice, AE 12 month, OP 12 month are the columns which are discrete data type. Remaining all other columns are in Boolean data type. If the disease is present, it is considered as true. If the disease is absent, then the Boolean value is considered as false. Then columns waiting list prioritized OP, waiting list unprioritized OP, diabetic OP, cancer OP, social community, readmission model, readmission likelihood. These columns are having single values. Then finally, we have the mortality risk, and this column provides the information regarding the patient's mortality risk. Next slide, please. These are the softwares and tools we are using in our project. First, we get into Python. It is a high level, interactive, and object oriented scripting language. Then MySQL. This is a relational database management system which is based on the structural query language. It is used in many applications, mainly data warehousing, e-commerce, and etc. Then finally, Tableau. It is a data visualization tool. It uses data to solve problems. and many of the organizations make use of this Tableau for visualizing the data. The next project is the data pipeline. Here, the data is collected from the client and then it is loaded into the Python environment. In this, we are performing the data pre-processing step. First, we are removing the unwanted columns, which is not necessary, and then handling the missing values. Next, we are changing the age column into categorical data. Then the modified data set is given into the data visualization tool. Here we are using Tableau as the data visualization tool, in which we are visualizing various diseases depending on the mortality risk by creating dashboards and stories. The next slide will be explained by Akila. Thank you.
Thank you, Anushya. Hello, everyone. My name is Akila. I'm explaining about data cleansing and data description. In the given raw data, there are so many columns. Some of the columns which are irrelevant with respect to mortality risk are removed. Null values and duplicate values are removed. For data preparation, we have converted the age columns into 4 different age groups: elderly, middle, young, and pediatric. Data description. These are the columns which are related to patients' diseases. Some are type of tests and some are medicines which are used to treat the diseases. Age of the patients. Anti-cog, a medicine that prevents blood clot. CHD, a type of a heart disease. Osteoporosis. It is a disease that weakens the bone. Mortality risk. It is a probability of premature death or as lost days of a life expectancy. Thank you. The next slides will be explained by Chandu.
Yeah, thank you, Akila. Now here I am going to explain the visualizations of some of the diseases that are affecting on mortality risk. Here you can clearly see that the visualizations with respect to the mortality risk considering alcohol, anti-cog, BP, antagonist, bone sparing, asthma with respect to the mortality risk. In most of the younger group, those are affecting with respect to the alcohol. Here you can see the anti-cog is also most of the persons like having like elderly group are affecting more. While compared with the PP and antagonist, the most of the people that who are in younger group are affecting more. And coming to the bone sparing, the elderly group are affecting with respect to the mortality risk. Here were compared to the asthma, the most of the people who are coming from younger group are highly. Next slide, please. Yeah, here you can see the B12 to the mortality risk. While coming to the B12, you can clearly see here the younger group are affecting more. And while comparing with the IP-HIST and AF, you can see here the elderly group are affecting more. While coming to the BMI, ACE, IP12M, you can clearly see the most of the people who are having like elderly group are affecting more. Yeah, next slide, please. And coming to the stroke, thyroid, statin, TSH with respect to the mortality risk. Here, most of the stroke, the persons who are having like strokes are having like elderly group are affecting more. While coming to the thyroid, this is the basic that we are having here. The most of the elderly group are also affecting high. While coming to the statin and TSH, you can clearly see that here the elderly group are affecting more. Next slide, please. Yeah, while coming to the summary, you can clearly see the most of the consumption of alcohol is high in the engaged group. While compared to the anti-coke, elderly group are affecting more impact when compared with the other age groups. You can see clearly that the BP value is high in young age group when compared with the remaining age groups. And for the pediatric age group is also at almost zero. While coming with the young age groups are suffering more from asthma. Here you can see the stroke and thyroid effects are high in elderly age groups. While comparing with the IS and AF, elderly age groups have more impact compared to the other remaining age groups. From here onwards, our one of the teammate, Divya, will continue on.
Thank you, Chandu.
Good evening, everyone. I am Divya. Let's look into some other visualizations. In this slide, we are looking at how different diseases like calcium deficiency, breathlessness, cervix removal, chronic pulmonary disease, chronic heart disease are affecting the mortality risk of different age groups. Here, calcium deficiency is highly affecting the mortality risk of young age group. Breathlessness, cervix removal, COPD, CHD are highly associated with the mortality risk of elderly age group. Here we have clopidogrel. This is a medicine which is used to treat the blood clots. It is highly recommended to use the elderly age group. Next slide, please. Here we have medications like palliative and pharmaco. Palliative is a medicine which is used to treat the pains. Is highly used by the older groups. And here pharmaco means combinations of medicines. Combinations of medicines are highly recommended to young age groups. And here we have some other diseases like osteoporosis, neuropathy, dementia, and depression, where osteoporosis is bone weakness disease, neuropathy is dysfunction of nerves, and dementia is memory disorder. All these diseases are highly affecting the mortality risk of elderly age group. And here we have the comparison chart. From this chart, we can clearly see that depression has the high correlation with the mortality risk of elderly, middle, and young age groups respectively. Next slide, please. Here we are looking at the cholesterol, cardiovascular disease, cancer, and chronic kidney diseases. Except cholesterol, cardiovascular disease, cancer, and chronic kidney diseases are affecting the mortality risk of elderly age group and cholesterol on young age group. Next slide, please. These are the summary points that we have observed from the each individual chart. Here we can clearly see that main diseases like osteoporosis, neuropathy, depression, dementia, all these diseases are highly affecting the mortality risk of elderly age group. And young age group are affecting by the young age group are suffering from calcium deficiency. From we can see that mostly elderly age groups are having the mortality risk. Next slide. From these slides, Karthik will take you forward. Thank you.
Thank you, Divya. Hello, everyone. This is Karthik. Here come some of the diseases like folate test. Here it shows whether the patient has taken the test or not. Most of the young age group people has taken the test. And next comes for the FEV1. It is a medical test majorly taken by the elder age patients. And next comes the echocardiogram, which is popularly called as ECG. It is a heart functioning test, which is majorly taken by the elderly age group patients. Next test comes to serum creatinine. It is a medical test majorly taken by the engaged patients. And these tests does not affecting the mortality risk highly. Coming to the diseases, next slide, please. Coming to the diseases like hypertension, which is affecting the blood pressure of the patient, which affects the mortality risk in high. Hypertension highly seen in elderly and middle age group patients. Mortality risk and associated with young age group and highly affected by epilepsy. And comes to LVSD. It is a heart disease highly affecting the elderly age group and mortality as well. And other diseases like heart failure, diabetes, and renal are highly affecting the mortality risk of elderly age group patients. Smoking is highly affected on the mortality risk and mostly seen in elderly age group, middle age group patients. And like flu vaccine and fractures and dipyridamole are seen highly in elderly age group. In this, factors are highly affecting the mortality risk. And next slide, please. Yeah, here comes some of the summary points for the above slides and visualizations. Now Ramya will continue rest of. Thank you.
Yeah, thank you, Karthik. Here, this is a short video of dashboards, just to let you know that how the final dashboards are working. In these dashboards, we use the highlighting option, where the highlighting option allows us to call the attention to the marks of interest by highlighting the specific location and dimming the remaining areas. Here, the highlighted action used to the different diseases, medications, and associated with respect to the age groups and mortality risk. Thank you. Next slide, please. Yeah, here we can see that elderly age group affects more in anticoagulants areas, and young age group is affects more in B12, BMI, etc. Where here in this dashboard, elderly age group is affects more in statin, stroke, and TSH. Here we can see that mortality risk is high in calcium with respect to age in elderly age groups, and here young age group has high mortality risk in pharmaco. Here mortality risk with respect to CKD is high in elderly age group when compared to remaining age group. Here elderly age group affects more in hypertension, LVSG, HF, and diabetes. Whereas elderly age group has high mortality risk in flu-vax, smoker, fracture, and diploma when compared to the remaining age groups. Young age group affects more high in folate test, CREST, where the elderly age group affects more in FE1 and echocardiogram. Thank you. Next will be continued by Mamta.
Hello everyone. Here we are discussing about the NCDs. NCDs are the leading cause of death globally. They are strongly influenced by four main behavior risk factors: tobacco use, insufficient physical activities, harmful use of alcohol, and unhealthy diet, which lead to elevated blood pressure. Now I am coming to the conclusion. Here we understand that we have to increase physical activity and healthy diet to make human healthy, so that it decrease the mortality rate. Next slide. In this project, advanced meditation technique may lead to increase in immunity of patient. That result decrease the cost of mortality risk. By providing proper medication for unhealthy habit like alcohol, cigarette, etc., can reduce mortality risk. Proper intake of a healthy diet lead to reducing different diseases that are affecting patient. Identifying the pattern of disease in different age groups and reducing death rate by following a balanced lifestyle and proper medication, creating awareness for a healthy life and providing satisfaction by improving patient health. Next. Yeah, if anyone having any queries, you can ask. Next slide, please. At last, I would like to thank our mentor who has given their support to complete this project. We learned a lot of things from their guidance. Thank you, Sarat sir and SP Pavni and Raju sir. And I also would like to thank all the team members who did work extraordinary. Thank you all for your work and support. Thank you so much.